All right, so in this recording, we're going to look at a few common muscles of facial expression. So when you think of muscles of facial expression, you'll think of muscles that are moving, in some way moving our forehead, our eyes, our nose, our mouth, or maybe somewhere around our neck region. So any of the common facial expressions that you may make, something like smiling, frowning, kind of a pouting motion, grimacing, all of these facial expressions are a result of one or more, usually several, of these common muscles of facial expression pulling on your skin and resulting in these different facial expressions that we see. So one common thing to keep in mind whenever we're talking about all of these muscles, so all the muscles highlighted on this page are all what are known as muscles of facial expression, and they're all innervated. They all receive their nervous stimulation and innervation by a common nerve, and this is our seventh cranial nerve, which is known as the facial nerve. Okay, so if we start here, we'll kind of go through these and talk about where they're at and what they're located on, and then what their general function is. So if we look here superiorly, we see something called the occipitofrontalis, and this is specifically known as the frontal belly. Okay, sometimes it's also just referred to as the frontalis. So if we rotate our model around, we also see one in the back, and this is called the occipitalis. So this is really one continuous muscle. So if you see it highlighted in blue here, it continues this whole way, but there is a frontal belly near the anterior aspect, and there's an occipital belly near the posterior aspect. So both of these, when they contract, first off, they're going to be attached to our occipital bone and parts of our frontal bone. And then as they contract, they're going to be moving our scalp, so moving maybe the skin of our posterior scalp, skin of our anterior scalp, and or possibly moving our eyebrows if we're talking about our occipitofrontalis, this frontal belly that you see highlighted on this anterior aspect here in blue. Okay, so this is moving our scalp. If you raise your eyebrows, something like that, this is being accomplished by this frontal belly of our occipitofrontalis, right? So if we continue and we go just inferior to this frontalis, we see this muscle right here, and this is called our orbicularis oculi. So the term orbicularis, we'll see this in a few different muscles, but this is referring to something like an orbit, so like a circle, something that is making this kind of concentric ring around an opening. Okay, so the opening in this case would be our eye socket, right, where we have our eye. So we have one on the right, we have one on the left as well. This orbicularis oculi, and the term oculi is referring to ocular, right? So referring to the eye specifically. It is going to be running around our eye, attached to our frontal bone, maxilla, and whenever it contracts, it is going to help close our eye. It's going to help close our eyelid, so as when we are winking, when we are blinking, this muscle is going to close. As it closes our eyelid and subsequently closes our eye. Okay. If we go just medial to that, we can see this one kind of thin muscle known as the Procerus, okay, or the Procerus, however you want to pronounce it. This muscle is a relatively small muscle, and again, keep in mind, as we're talking about these are extremely small, so in a gross anatomical sense, if you were to ever dissect these, they're extremely thin, they're extremely delicate, they're extremely small, okay? So they look very nice and clean here, and on a model they typically are, but keep in mind on an actual cadaver, an actual specimen, they're sometimes difficult to locate. So this muscle is going to be running anteriorly between the two orbicularis oculi muscles. It runs from kind of the bridge of the nose up onto our the region of where we have our occipitofrontalis, that frontal belly, and whenever it contracts, it is going to raise our nose as if we were kind of smelling, like if we were kind of looking up to smell something, and it can also help to draw our eyebrows down, right? So our eyebrows are going to be just lateral to these two muscles, and so when it contracts, it can also help to draw those eyebrows kind of down and in as well a little bit too. Okay, so if we continue inferiorly from this Procerus muscle, we see our Nasalis muscle. Now the Nasalis has a couple of different segments or different portions, but we're just going to highlight just this one portion here. And this is right here on the lateral aspect of our nose. So if you feel what we generally think of as our nose, which is essentially cartilage, and you run right on the lateral aspect of that, deep to that skin that you're touching, there's going to be this nasalis muscle. This nasalis muscle attaches to that cartilage of the nose, and it's going to attach down onto our maxilla. And whenever it contracts, it's going to kind of flare our nose outward, kind of toward the septum, and it's going to help essentially flare our nostrils, right? So whenever we think of doing this, it can elevate the nostril and kind of draw it out as if we were going to bring, or we were going to take in a big inhale or smell, something like that, okay? So if we continue now inferiorly and kind of laterally, we get to some muscles that are now going to be moving our mouth. So the first one here is one known as levator labii superioris. And so if you look at this muscle's name, levator labii superioris, if you know this name and you know what these words mean, then you know the action of this muscle. So the term levator, you may be thinking that sounds a lot like elevate, and you're exactly right. So this levator means elevate, labia means lip, and then superioris means superior. So this means the muscle that is raising or elevating the superior lip or the upper lip, and that's exactly what we see. So when this muscle contracts, it's attached to the zygomatic bone, and it draws that mouth up, it draws the lip upward, and moves it kind of forward as well. So if you were kind of puckering or kind of moving your lips outward and up a little bit, okay? If we go just deep to that, and I'm going to highlight it right here in blue, this is one is known as the levator anguli oris. And again, if you know the names of these terms, you know the action here. So levator, again, elevate, oris means mouth, anguli means the corner. So this is the muscle that is elevating the corner of our mouth, or sometimes referred to as the angle of our mouth, okay? So if we were going to, this is one that contracts whenever we smile, and we raise this corner of the mouth superiorly and kind of laterally as well, okay? All right, we then have two muscles known as zygomatic muscles. So we have a zygomatic minor, and we have one known as a zygomatic major. Both of these muscles are going to be doing something very similar. They're going to be drawing the lip kind of outward, maybe a little bit laterally, and kind of upward as well at the same time, okay? So these are largely involved in our process of smiling. So whenever we smile and we raise our upper lip and we kind of raise it up and we raise it outward and we raise it laterally as well, that is what these zygomatic muscles are doing. So sometimes they're referred to as zygomatic major and minor, or sometimes they're referred to as zygomaticus major and minor. Okay, both of those terms are completely acceptable. Okay. All right, if we look at this one running right on the lateral aspect of the mouth, if we come here, we see this one here. This is known as the Risorius, all right? This is going to kind of draw and retract and pull the angle or that corner of the mouth kind of out and laterally. So again, whenever we are smiling, if you think of the corner of your mouth, whenever you smile, that corner of your mouth kind of is pulled out and kind of pulled backwards as well, and that is the function of this Risorius muscle here. So it's kind of pulling the mouth laterally whenever we grin, whenever we laugh, something like that, okay? All right, if we go deep to this muscle, we see this large one here known as the Buccinator muscle, okay? Some people call it the Buccinator, some people call it the Buccinator, either are largely fine, okay? What this muscle does is if you imagine, so just superficial to where this muscle is highlighted, this is where we'd have our cheek region, okay? So deep to this is our Buccinator, this Buccinator. So when this muscle contracts, it is compressing our cheeks as we are blowing something, as we are chewing, and we'll talk about different muscles for chewing in a separate video. But this Buccinator muscle is acting to compress that mouth as we're chewing. If you think of when you're whistling, this muscle is also going to be contracting. If you think as if you were playing an instrument and you were blowing into a trumpet or you're blowing into a horn and you have to compress your mouth to force that air outward, this Buccinator muscle is largely responsible for that, okay? All right, if we continue inferiorly, we have a few more muscles that act on our lips. So we have this one here known, if I can click on it, known as the depressor anguli oris, all right? So this is very similar to the levator anguli oris, except this one is on the inferior aspect, and it is depressing that lip, or it is pulling the mouth, or the angle of the mouth, inferiorly. So whereas we had this one here, the levator anguli oris, that's pulling the corner of the mouth up, here we have the depressor anguli oris, that would be pulling and drawing that corner of the mouth or that angle of the mouth, pulling it downward. Okay. We also have a depressor labii inferioris, just like we had a levator labii superioris. So if the levator labii superioris was drawing the mouth upward and outward, the depressor labii inferioris is drawing it inferiorly. Okay, so it's pulling that mouth down. So whenever you think of something like frowning, or you think of kind of puckering that lip, that bottom lip out, this depressor labii inferioris muscle is helping with that. Okay. We also have this one here known as the mentalis. So if you remember that this region, our chin region, is known as the mental region. Okay. So the muscle located in this region is known as the mentalis muscle. Okay. And this is also going to be helping in kind of protruding our lower lip and wrinkling the skin. So if you kind of pucker and you kind of frown as if you were pouting and you stick your bottom lip out, that skin over your chin, over that mental region, kind of becomes a little wrinkled. As this muscle contracts, it draws and it pulls that lip outward, and when it does it, it wrinkles the skin over that region. Okay. All right, so if we look here, we also have one muscle that is analogous to the Orbicularis oculi, except it is called the Orbicularis oris, right? So same thing, Orbicularis is meaning an orbit. It is encircling something. And in this case, it is the oris, or the oral cavity, so it is encircling the mouth, all right? So whenever this muscle contracts, it is also going to be largely responsible for closing the mouth, and it can also be responsible for kind of protruding the lips as well, or keeping the lips of kind of tight and together as if we were whistling or you were playing an instrument, something like that. So if you think of when you whistle, or you put your lips in the position as if you were going to whistle, even if you can't whistle, whenever this happens, this is responsible, or this is being produced by the action of this Orbicularis oris, as it is kind of pulling the lips together, protruding them out, closing them, and putting them into kind of this puckered position. Okay. All right. One final muscle that we'll look at is this one down here. This is the platysma, right? So the platysma is a very, very, very thin, extremely delicate muscle of facial expression, and it runs from the inferior aspect of the mandible all the way down to kind of where our clavicle is and where our pectoralis major and part of our deltoid is as well, all right? So this muscle is, again, it's a facial expression muscle, so it's going to help in drawing kind of our mouth down, the corners or angle of our mouth. It is also what is going to kind of flare our skin and wrinkle the skin over our neck whenever we clench our teeth. So if you think of kind of clenching your teeth and kind of like you're grimacing, you can feel that skin over your neck region. You can also feel the tendons in that region. You can feel those all kind of wrinkle and all kind of flare out. That is responsible, this muscle is responsible for producing that action. So as this platysma muscle will contract, it will flare that skin in this region, but it can also help in kind of pulling on the skin of the face and pulling on the mouth and kind of drawing that inferiorly just a little bit as well. Okay, so these are all of our muscles of facial expression. Again, when you think of smiling, when you think of grimacing, frowning, whistling, any of these motions that or these movements that we're doing with our eyes, with our face, with our mouth, our chin, our cheek, forehead, eyebrows, any of these, we generally have several muscles acting at once. Okay, and this is not all of the muscles. There are a few here that I removed, but these are the primary muscles here that you should be familiar with. Okay, so think about where they attach to, what bones they attach to, where they're traveling, and based on their name, based on their location, you can formulate a pretty good idea about what type of movement it is going to produce. All right. So in the next video, we will talk a little bit about some of our muscles of mastication. So meaning the muscles that are responsible for moving our jaw, moving our mandible, and allowing us to chew things.